Most people don't know there are 6 medicines you should never mix with turmeric. Have you ever wondered if the turmeric you add to your meals could actually be dangerous? It's packed with health benefits, but combining it with certain medications can lead to serious health risks. Imagine the scary reality of a natural remedy turning harmful. Are you aware that this beloved spice could interact with your medications in ways that could make you feel scared, sad, or even angry? Today, we're revealing the 6 medicines you should never mix with turmeric. You'll learn how these interactions occur and the scary potential health risks, as well as hear real-life examples that will leave you shocked and informed. Don't miss out on this crucial information that could bring you both joy and peace of mind. Medicine number 1, blood thinners. Have you ever thought your heart-healthy habits might backfire? Turmeric can make blood thinners risky. Blood thinners, or anticoagulants, are medications that help prevent blood clots from forming. Common blood thinners include warfarin, aspirin, and heparin. These medications are crucial for individuals with conditions like deep vein thrombosis, pulmonary embolism, or those who have had a heart attack or stroke. Imagine Jack, an elderly man taking warfarin for atrial fibrillation. He started incorporating turmeric supplements into his diet. Within weeks, he experienced severe nosebleeds and significant bruising. Upon the medical examination, it was discovered that his blood had become too thin, necessitating an adjustment to his warfarin dosage and the cessation of turmeric supplements. Turmeric contains curcumin, a compound with natural blood-thinning properties. While this can be beneficial for cardiovascular health, it becomes problematic when combined with blood-thinning medications. Curcumin can enhance the effects of these medications, increasing the risk of excessive bleeding. The primary risk of combining turmeric with blood thinners is an increased risk of bleeding, which can be severe and life-threatening. Symptoms may include unusual bruising, prolonged bleeding from cuts, increased menstrual flow, nosebleeds, and gastrointestinal bleeding. What about your diabetes medication? Turmeric can turn blood sugar management into a scary roller coaster ride. Medicine number 2, diabetes medications. Diabetes medications help manage blood sugar levels in individuals with diabetes. These include insulin and oral hypoglycemic agents such as metformin, sulfonylureas, like glipizide, and meglitinides. Turmeric has been shown to lower blood sugar levels, which can be beneficial for people managing diabetes naturally. However, when combined with diabetes medications, this effect can be amplified, potentially leading to dangerously low blood sugar levels, hypoglycemia. The primary risk here is hypoglycemia, which can cause symptoms like dizziness, confusion, sweating, headache, and in severe cases, seizures, loss of consciousness, and even death. Imagine Melissa, a middle-aged woman with type 2 diabetes, decided to start taking turmeric supplements to help manage her condition. She continued her prescribed dose of metformin, but soon began experiencing frequent episodes of dizziness and sweating. Her doctor found that her blood sugar levels were dangerously low, and she was advised to discontinue the turmeric supplements and monitor her blood sugar more closely. If diabetes meds and turmeric don't mix, what about cancer treatments? Up next, the surprising effects of turmeric on chemotherapy. Medicine number 3, chemotherapy drugs. Chemotherapy drugs are used to treat various types of cancer. These powerful medications work by killing rapidly dividing cancer cells, but they also affect healthy cells, leading to a range of side effects. Turmeric has antioxidant properties that can potentially interfere with the oxidative stress mechanisms through which certain chemotherapy drugs kill cancer cells. This interaction might reduce the effectiveness of the chemotherapy treatment. The main risk is that turmeric might reduce the efficacy of chemotherapy drugs, potentially leading to suboptimal cancer treatment outcomes. This can result in cancer progression and decreased survival rates. A cancer patient undergoing chemotherapy for breast cancer began taking high doses of turmeric supplements to help cope with inflammation and pain. Unfortunately, follow-up scans showed that her tumors were not responding as expected to the chemotherapy. Her oncologist suggested stopping the turmeric, and subsequent treatments showed better efficacy. Wondering if your everyday antacids are safe with turmeric? The next segment might surprise you. Medicine number 4, antacids. Antacids are used to neutralize stomach acid and provide relief from heartburn, indigestion, and acid reflux. Common antacids include aluminum hydroxide, magnesium hydroxide, and calcium carbonate. Turmeric can increase stomach acid production, which can counteract the effects of antacids. This means that turmeric could reduce the effectiveness of these medications and worsen symptoms of acid reflux or indigestion. Combining turmeric with antacids may lead to persistent or worsening symptoms of heartburn and indigestion. This can cause discomfort and lead to more serious conditions like esophagitis if left untreated. Imagine Ahmed, a young man who was suffering from chronic heartburn, was prescribed antacids to manage his condition. He started adding turmeric to his diet for its anti-inflammatory benefits. However, his heartburn symptoms worsened, leading to further investigations. His doctor advised him to stop consuming turmeric, after which his symptoms improved significantly. Turmeric boosts the immune system, but is that always good? Next, find out about the hidden dangers of immunosuppressants. Medicine number 5, immunosuppressants. Immunosuppressants are medications used to suppress the immune system, commonly prescribed to prevent organ transplant rejection or to treat autoimmune diseases. Examples include cyclosporine, tacrolimus, and methotrexate. Turmeric can boost the immune system, which might counteract the effects of immunosuppressant drugs. This interaction can lead to a reduction in the efficacy of these medications, risking organ rejection or worsening autoimmune conditions. The primary risk is that turmeric may reduce the effectiveness of immunosuppressants, leading to potential organ rejection in transplant patients or flare-ups in autoimmune diseases. This can cause serious health complications and may require adjustments in medication or treatment plans. A kidney transplant recipient taking cyclosporine was advised to follow a strict regimen of immunosuppressants. Seeking additional health benefits, he began taking turmeric supplements. Soon after, routine tests showed signs of organ rejection. His healthcare team identified the turmeric supplements as the culprit, and once discontinued, his condition stabilized. We've seen how turmeric can interfere with serious meds, but what about your cholesterol-lowering statins? The answer might shock you. Medicine number 6. Statins. Statins are medications used to lower cholesterol levels in the blood, thereby reducing the risk of heart disease. Common statins include atorvastatin, simvastatin, and rosuvastatin. Turmeric can interact with statins by affecting liver enzymes responsible for metabolizing these drugs. This interaction can either increase the levels of statins in the blood, leading to potential toxicity, or decrease their levels, reducing their efficacy. The risks include muscle pain and damage, rhabdomyolysis, liver damage, and an increased risk of statin-induced side effects. Symptoms may include muscle weakness, fatigue, and dark urine, indicating muscle breakdown. Imagine Lily, an elderly woman on atorvastatin for high cholesterol, started drinking turmeric tea daily. Over time, she began experiencing severe muscle pain and weakness. Blood tests revealed elevated levels of creatine kinase, a marker of muscle damage. Her doctor identified the interaction between turmeric and atorvastatin as the cause and advised her to stop the turmeric intake. Her symptoms gradually improved thereafter. Now that you know the risks, how can you safely enjoy turmeric? Up next, let's explore some important practical tips and alternatives for those taking these medications. Practical advice and tips. If you're taking any of the medications mentioned, it's crucial to be cautious with turmeric consumption. Always start with small amounts and monitor how your body reacts. Avoid high-dose turmeric supplements unless supervised by a healthcare provider. Incorporate turmeric naturally through food in moderate amounts, such as adding it to curries, soups, or smoothies. For those who need to avoid turmeric, there are other sources of anti-inflammatory and antioxidant benefits. Ginger, for example, has similar properties and can be used in cooking and teas. Other alternatives include cinnamon, which helps manage blood sugar levels, and green tea, known for its antioxidant benefits. Additionally, omega-3 fatty acids found in fish oil or flax seeds are excellent for reducing inflammation. These alternatives provide similar health benefits without the risk of harmful interactions with your medications. Before making any dietary changes, especially if you're on medication, consult with your healthcare provider. They can provide personalized advice based on your medical history and current treatment plan. This ensures that you get the benefits of turmeric without compromising your health. And did you know that papaya seeds have miraculous health benefits most people don't know about? Click on this video above to learn how papaya seeds can boost your immune system, give you better sleep, and do much more on NATURALdocTV.